Hi everybody, my name is Mani Alikhani. I'm the Dean and Professor of CTOR Academy. I'd like to welcome you to CTOR channel. The topic of today's discussion is force. Force is an action that we take against an object. In orthodontics, we apply the force to a tooth. In response to our application of force, the tooth moves. But not always in response to force, we have a movement. For example, if I apply a force to a wire that is attached to the wall, the wire will deflect. In general, when we're talking about the force, two aspects of the force is important for us. One is magnitude and one is direction. Let's look at the magnitude first. Usually we define magnitude or demonstrate magnitude of the force as an arrow. Depends on the length of the arrow, that is arbitrary things that we select, we define what would be the unit of our force. So assume in this slide we decided to demonstrate that short arrow as 50 centinewton. Now by increasing the force, for example 100 centinewton, the length of the arrow should be twice more. And proportionally the length of the arrow would be increased if we are increasing our force. The magnitude of the force when we are studying the movement of an object is very important. We know from our personal experience, if we apply a force, for example, if we applying a force to a ball by baseball bat, the object or the ball will move. If we hit the ball with a higher magnitude of the force, the object moves faster and for a longer distance. So there is a relationship between the magnitude of the force and the movement of the object, and we can study that. And based on that study, we'll come with a formula. There is a relationship, how much I apply force and how much movement I can predict that object will have. This linear relationship, this formula, this mathematical formula, does not exist in biology. In another word, you cannot say there is a relationship between magnitude of the force and magnitude of the tooth movement. There is a biological reaction between that can transfer or translate the force to a movement. And if you want to make a formula, you need to have that biological reaction as part of your calculation. Therefore, the relationship between the force and the tooth movement in biology is not linear. As we discuss later on when we're talking about the biology of tooth movement, is actually increasing the magnitude of the force does not necessarily mean it will increase the amount of the movement. The second subject that I like to talk, or we need to know when we're talking about the force, is direction. When we're talking about the direction, we need to define three components of it. Where the force is applied, that is called point of application. At what line the force was applied, that is line of action. And where is the head of the arrow pointed toward, that is called sense. Let's look at each one of these components differently. If you look at the point of application, for example, in this example, if you look at the red dot is a center of resistance. We will talk about the center of resistance in the next subject. When we apply a force on the center of resistance, we can say the point of application is center of resistance. On the other hand, I can apply the force on the crown, and therefore the point of application would be a point in the crown. The second component of the directions that we need to define anytime that we're talking the force is a line of action. For example, if you look at the right side of the slide, the line of action is the line that is passed through the arrow, and as you can see, it passed through the center of resistance. In the left side of the slide, the line of action does not pass through the center of resistance but pass through the crown. So these two forces, they have different point of application, different line of action. However, we can have two forces that have same point of application but different line of action. If you look at these examples, you will see that both line of action pass through the center of resistance, so the point of application is the same, but the line of actions are different. Knowing the point of application and line of action is not enough to define the force. The next component is sense. So let's look at the example. Assume in this example, the point of application is center of resistance. The line of action is the line that you are seeing on this slide. But what happens if one arrow is pointed toward upward and one arrow is pointed toward downward? They have the same line of action, they have same point of application, but they can exactly opposite effect. So anytime that you're talking about the force in orthodontics, you need to define these two main components, magnitude and direction. And anytime talking about the direction, we need to know the point of application, line of action, and sense. Based on point of application and line of action and the relationship that they have with the center of resistance of the object, the type of movement is defined. And also, the direction of the movement is defined. Therefore, while magnitude of the force has significant importance from the biological aspect, the direction is the fundamental point of the force in defining the outcome of the treatment. Thank you for watching the first session of mechanotherapy discussion. If you are interested to see the next subject, that would be center of resistance, please keep watching. Thank you again.